boy like that, it's easy to figure you out. If I can have you now, then easy's what I'm about. I think you might be the...
It is important to know the proper way of donning and doffing of PPE. It is to reduce the risk of touching, transmitting, or being exposed to pathogens. Correctly donning and doffing of personal protective equipment is a crucial step in preventing and controlling infections in healthcare settings. Donning. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, N95 filtering face piece respirator, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable pre- and examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or wash your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties, you may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown, and then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the face piece bulges slightly. Then while keeping your hands over the respirator, take in a quick deep breath, checking that the face piece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. Doffing. Before leaving the patient's room, remove and discard your gloves. Gloves can be removed using more than one technique. For the glove-in-glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With a beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Discard the gloves. Next, remove your gown. Untie all ties. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. After leaving the patient's room, perform hand hygiene by using alcohol-based hand sanitizer or wash your hands with soap and water for at least 20 seconds. Be sure to clean your wrist where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps, or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask.
Do I like that? It's easy to figure you out. If I can have you now, then easy's what I'm about.